Hello, my dear friends. Today we're going to talk about what is good crown. My name is Dr. Dmitry Gorbatov. I'm practicing holistic and cosmetic dentistry for more than 30 years in Hollywood, State, Florida, right on South Ocean Drive. How we can, decide if the crown is good or crown is not good? We all got situations when you come to the dentist and the work was done recently 1-2 years ago, and then you go to another dentist and he's gonna check your work and said, well, this crown is not good, you should change it, or color is not right, or the margins is not right, you should change the crown. And of course you're not happy about it because you just spend the money on this restoration, those things are pretty expensive. And then another dentist, basically another professional of this of this field, telling you the crown is not good. Okay, so I'll tell you what's the gradation, how we judge. No, I mean, the simplest way to judge it, first of all, from just the way it looks, right? So crown have to be proper shape, proper size, okay, and proper color. So it have to be aligned with the rest of the teeth in terms of the color, shape, and size. Second of all, it has to be comfortable. So it means your bite, your occlusion have to be properly corrected. So if you have a flat teeth, the crown not supposed to be the sharp cuff, it's supposed to kind of resemble your own teeth the way they are right now. So if your teeth are pretty flat, you grind a little bit, you clench a little bit, then the crown supposed to get the same shape like your own teeth, then give you comfortability during the biting, during the chewing. And then the dental part comes. Usually it's difficult to judge. Another, which is margins of the crown. So the crown is kind of like a basket, right? So it got margins all around on the level of the gums. So when we see the crown, the first things we'll check, we go underneath and we go underneath of those margins to make sure the margins are completely sealed. Because if the margins are not sealed and the crown kind of like, instead of be tied around the tooth like this, right? It's gonna like open margins like this. So food gets stuck up here and the gums get flamed. So we see a lot of crowns like this when they were done and the margins are not precise, so food gets stuck underneath. Bacteria live there. That's a beautiful home for them. And then the gums around start become spongy. It start to get inflammation. So every time you brush, every time you floss, you got bleeding. That bleeding is indication there is a chronic inflammation. There is something wrong with the crown. This is not good crown. This is a bad crown. This is the most problematic area, the margins, because that product of inflammation can cause your bone loss. So they eat the bone away, bone goes down, and teeth become sensitive. They become less stable, and basically, if some people got crowns like this for 10-15 years, they're gonna lose the tooth because of the bone loss. Another problem which we really see as a problem with the bad crown compared to the good crown is the contact between the teeth. The contact between the teeth have to be not tight, not loose. So if the contacts are loose, it means the contact is open every time you eat anything, especially like meat, chicken, some salads, the food gets stuck between the crowns. Right? First of all, it's uncomfortable. It could be painful and it feels like a toothache, but it's not. It's just the gums become inflamed and that pressure causes that toothache. So then you have to go, you have to clean it up, you get to put the floss, you have to put the toothpick or anything, just clean up the area to get rid of that pain. So the same thing, that area is constantly inflamed, right? The product inflammation causes bone loss around that area, creating pocket, and kind of like it's like a circle. The more you eat, the more you got food impaction, the deeper the pocket is. So if you have any of those symptoms, all right, do not let it go. It is not right. It's not supposed to be this way. Your margin is supposed to be precise, that you have no bone loss. Your contacts have to be tight and precisely done to make sure that there is no food impaction, there is no inflammation of the gums. The crown has to be properly aligned. The crowns have to be proper size and proper color. All right. If you have any of those situations like gum bleeding, food impaction, or you're not sure, you constantly you brush your teeth, you constantly got like a pain sensitivity or bleeding, please come us. Let us take a look and decide what could be done. Should the crowns could be replaced? Maybe there is another way to help you out to restore that area nicely, so you have no symptoms and you're happy with this. Please let us know if you have any of those things. We're glad to help you out. Please subscribe to our channel and please call us, and we're glad to help you out. Okay, thank you very much, and thank you for watching us.